Can you help those who are listening understand the difference between ovulation induction versus intrauterine insemination versus IVF, and who's the client who needs each of those to help conceive?
Sure. That patient you just mentioned has unexplained infertility. Doesn't mean there's no explanation, just means we're not smart enough to figure it out. Okay. I always tell my patients, like, unexplained infertility is the most frustrating kind of infertility. You're like, what's happening and why don't we know? But I always tell them, if this was like Harry Potter and you were trying to pick your infertility out of a hat, it's the one that you would want to pick, because it means that there's not a problem that we can't overcome. If we found out that you ran out of eggs, great, that's an explanation, but that means that it's going to be challenging to get you pregnant with your own eggs. Same thing with sperm. But if you don't have a problem that we can ascertain, then we just have to get those sperm and eggs closer together in some of the ways that we'll talk about. So it's the most frustrating, it's very common, but it's honestly the one that I hope my patients have, because we can typically overcome it with our treatments.